It's hot, so I'm going to try to be as short as I can. And I have three things. Number one, I want to thank everybody that is here. Every one of you coming here is part of this. This is just the start of making sure that everybody knows about this, because that's how things change. Number two, I'm going to talk a little bit about what Clinton said, a little bit about the shame, stigma. We can change that. We can change that by telling stories. I'm lucky because I don't have a family member that's in this situation. I don't have super close friends. But I do have friends that I've known that have gone through this. I have friends that have told me about it, later, and they're fabulous people in our community, but yet that's where they were at one point in their lives. And it takes stories, it takes facts, and it takes stories. And so every one of you here, I would guess, knows somebody. They know somebody that's important to them. You can tell that story about who they were. They are not that person. They are not that drug. They are not that alcohol. They are a different person. They have all these different kinds of features to them that you loved and love. And so you have an opportunity to tell those stories, even if they can't do that. And then the third thing, I think that was real quick. We have three. The third one, I'm going to come up here a second. I don't know if you know, this woman is amazing. This woman is why Minnesota a couple years ago changed legislation so that you can so you as a parent could have it would have been nice if it was back then, that medication that can save. You could be that person that has access to it. You don't need to intervene and have somebody in. And kudos to North Dakota for having started this. Let's spread the word that they have it, so that the pharmacies and all the people that can get it know that. And I'm going to go along with my governor, Governor Dayton, who earlier this morning did a proclamation. And I, in my capacity, and this is for you, I'll take it when you're done. Whereas, as a community, we honor those lost to the growing epidemic of overdose-related death, support those who struggle with drug use or abuse, and reinforce the belief that no one should feel shame or disgrace due to an overdose-related death of a loved one. And whereas it's imperative to recognize that every human being is worthy of our best efforts to prevent injury and death from overdose, Overdose Awareness Day reminds us to support overdose prevention projects and to help the wider community understand that drug overdose is a social issue which impacts not only the victim, but families, friends, and the community. And whereas Overdose Awareness Day provides an opportunity to recognize that painkillers and other prescription medications play an important role in our well-being, and that misusing or abusing those drugs can have tragic and long-term consequences. And whereas the City of Moorhead residents have a proud tradition of collaboration with international events as part of our active participation as global citizens, International Overdose Awareness Day is celebrated on August 31st, 2015 by thousands of people who will stand beside friends and families of fatal overdose victims to remember those who have been lost to overdose, to support those who are left behind, and to recommend to recommit to overdose prevention efforts. And now, therefore, I, Delray Williams, Mayor of the City of Moorhead, do hereby proclaim August 31st, 2015, Overdose Awareness Day in the City of Moorhead. Thank you.
Thank you, Mayor Williams. And just so we all are clear about this, that was wonderful of you to say, but it was a collaborative effort of a bunch of people in the state of Minnesota that worked long and hard on Good Samaritan legislation and the naloxone bills that were Steve's Law that got passed in Minnesota. But I'm going to turn it back over to Jeremy because